And so our first speaker of the day is Professor Denise Wilson, who has dedicated her career to advancing health and social outcomes for whānau Māori. She's a Professor of Māori Health and serves as the Associate Dean of Māori Advancement, where her leadership and scholarship continue to shape transformative approaches to equity and wellbeing. And as I mentioned earlier, she is also the lead of the project Kei Roto To Ta, tou Rongoa. So ho mai te piki paki more Professor Denise Wilson.
Right. Tēnā koutou, tēnā koutou, tēnā koutou katoa. Nau mai, haere mai, e aku manuhiri. Tēnā koutou katoa, kua hui hui mai nā runga e te kaupapa o tēnei rā. Ka nui te mihi, ka nui te aroha kia koutou. Kei te haere, kei te koha, te nākau, kia kiti, e a koutou. Ka nui te mihi Isaac mō te whakatau me karakia, nō reira e te rangatira mā kaimahi mā tēnā koutou, tēnā koutou, tēnā koutou katoa. He uria hau, tainui, Ngāti Parau ki Heratonga, whakatohia Ngāti Onioni me Ngāti Tūwhare Toa, ko Denise Wilson ahau. Greetings to you all. Today is the culmination of a Health Research Council project grant titled Kei Roto To Ta, tou Rongoa, whānau and community approach to wellbeing. Before I begin sharing the findings, I acknowledge that some of our providers are unable to attend today due to illness and having to cover these services. I want to make some acknowledgements. The generosity of the 7 kaupapa Māori providers throughout Aotearoa enabled us to undertake 3 wānanga over the course of the research. Ngā Pui Iwi Social Services, Te Whānau o Waiparira, Te Whakariri Hau Waikato Women's Refuge, Tūtama Wahine o Taranaki, Te Oranganui, Te Tai Whenua o Heratonga, and Te Wakutapu. Your belief in this project when I initially approached you to participate, especially the grand design and what we would produce, and that we would produce something meaningful will always be remembered and valued. On behalf of the research team, we greatly appreciate your aroha manaakitanga and your aspirations for our whānau to have a better future that are exemplified in the whakatauki e hara taku toa, e te toa taki taha, e toa taki tini. My or our strength is not an individual or research team alone, but as a collective. This research could not have happened without the generosity, awhi and support of the whānau and kaimahi who participated and willingly shared their pūrākau and their thoughts about what would assist them in their journeys to achieve wellbeing. I want to also acknowledge the critical roles of Dr. Moana Uruwera in the first year of our project and Huri Campbell, who ensured this research occurred and they got us to the right places at the correct time. Importantly, I want to pay my utmost respects to Jordan Tani, Cassie Clue, Briar Dowling, Emma Bushnick and Stephen Ray for turning research into resources that honour our whānau and reminding me, as Briar put it one day, you're in the design room. Lastly, I want to acknowledge the research team that brought their expertise to this research. Pātana Henare Tate's whakatauki underpin this research. Mā te whakatū ka mōhio, mā te mōhio ka marama, mā te marama ka mātou, mā te mātou ka ora. By discussion comes understanding. By understanding comes enlightenment. By enlightenment comes wisdom. by wisdom comes life everlasting. So, to get on with the presentation. So, just to give you a quick snapshot of the background, this project came on the back of a Marsden-funded study that looked at how Māori keep safe in unsafe relationships. Having spent 6 years on the Deaf Review Committee, I really started questioning, if these women aren't getting the services that they need, if they're asking for help and they're not getting it, yet people actually write it in their records, what they've asked for, how are they keeping safe in these seemingly unsafe relationships? That study really highlighted the role of the system in entrapping them into, relationships that weren't safe for them or their tamariki. And we got to understand a lot about what they do in the face of adversity to try and protect their tamariki and keep them safe. But that's not always, what the end story was either. But so this study really aimed to look at a holistic prevention approach that was embedded in Te Ao Māori to optimise the oranga of whānau. And it's about, looking at aspirational futures. So we had 7 sites across the country, and I had this elaborate research design that at the beginning of the year, doing all the travelling was it was tricky at times, trying to fit it all in and with the providers to get to the end. But I truly believe that in the end it was good. This is not how we intended it to be, but it became very clear that Wānanga 3 just couldn't be a national wānanga with our whānau for various reasons, and for some of them that was safety. So we looked at going back out to each of those wānanga. So the findings from each site, where wānanga discussed and what have you, and we brought all those sites back together, and there was a lot of overlap and commonality across the country in what whānau was saying. So in the first 2 wānanga, we had 115 whānau and kaimahi involved. And in the 3rd wānanga, where we took out the resources for the, a sort of final endorsement, there were 99 people. And so I think that's pretty good for a qualitative study. But one of the things that our whānau were really clear of was that we didn't forget their realities. That while we're looking at all the positive things and looking at the aspirational things, they didn't want us to, to just ignore the realities that they're in. And actually, quite frankly, the realities were something that we couldn't ignore. So I'm just going to begin with their realities. So we had... I anticipated that we would have, 2 or 3 people from a whānau that would come together, and they maybe bring their tamariki with them or maybe not. But what we actually found that most of the participants were a whānau of one. We had a few where, a couple of partners, a mother and daughter, but predominantly they were a whānau of one. And what we found was that their circumstances had distanced them from their whānau, but the role of the agencies also seemed to put a wedge in, really disconnecting the whānau, making it difficult for them going forward. And for some whānau, it wasn't good for them to be reconnecting either. But what we saw were whānau that were entrapped in these situations, often with no support when they needed it most. They had low or no trust of others, and they were isolated. And we definitely, that trust thing was a really big thing. And in one of the first wānangas, we spent a significant amount of time talking with them before they decided that, yes, they would participate. It was okay. But, as we've gone over, if I thought things were bad for our wahine Māori and our e tū wahine stuff, things are infinitely worse and have seemed to have got worse across the course of the study. So these are things that I think we need to think about, because they had no support. They relied on services and government agencies to provide that support, but they were not necessarily respected and treated well. The other thing we've talked about is the unsafe housing. Well, that should be unsafe housing because we decided to take the emergency out because it's unsafe across the board. So it wasn't safe for their tamariki. Some of them knew that, so they would put their tamariki somewhere else, all the while knowing that maybe they would lose them for doing that. They were subjected in those housing situations to violence, sexual violence. Some of them were forced into prostitution. We heard about the alcohol and the drugs, the drug dealing that was going on in close proximity, the presence of gangs in some cases, and being forced to withdraw their income support and hand it over, but really, the precarity and transience. So there's no guarantee that they had housing for any length of time, and that makes it really important to understand that then it makes it difficult for them to get their tamariki into schools, and it also makes it difficult for them to be in employment. And so if you look at a place like Tamaki, and one minute you might be on one end of Tamaki, and then you get shifted. You've told at midday that you can't, the housing hasn't been paid, so you have to shift. And that might be to a whole different area of Tamaki. And so, public transport isn't a guarantee that you can get from point A to point B quickly. So that was really important. Also, the oranga tamariki effect, where it seems that they leave a path of chaos and destruction amongst these whānau that we had in our study. They were often rendered powerless. They didn't understand what the process was. Nobody would give them information. Often they didn't know why their children had been lifted or removed from their care, and what have you. So they were disconnected, so that it was quite an isolating experience. And I think it's useful to note that a lot of them talked about their children being removed from their care in the night, in the early hours of the morning. And we heard one wahine talk about how her baby was ripped from her breast while she was feeding it at 1 o'clock in the morning. So, and every whānau in the study wants to be good parents, and they want good outcomes for their tamariki. Their situations make it really difficult. And they need people from the outside who have some understanding of listening to their stories, because they're all a little bit different, and going from there. But, getting their tamariki back was an infinite fight, taking some years. There were shifting goalposts, so they would do everything they have to do, and then there's a new set of hurdles to jump over, and a new date. And if they did get their children back, they didn't get them back quickly. So, and that, that destruction of whakapapa in the process, and the destruction of the relationships. And we heard from Tani as well, how pauri they were as well, even if they weren't living with their children at the time. But, and we also heard from grandparents who were neither equipped or resourced to look after tamariki with complex needs, yet expected to do that, but because they then became in their care, any help from oranga tamariki was severed. And then we heard trafficking. And I do have to admit that the first time I heard it, and I thought, oh yeah, that's in my head. I haven't heard that one before. We've heard it from every site by multiple people. We have examples where children have been taken and they've been placed into some foster care for people who want children for life. Five tamariki that were wrongfully uplifted. The court got involved and said yes, they were wrongfully uplifted. She got the 3 older ones back. The 2 babies were with a foster family who wanted children for life. They couldn't have their own children, but they had the resources, the networks and connections to fight the system and take oranga tamariki to court. So, the stories that they told are just devastating, because how do you even begin to think about fighting that? It's really hard. And so we have started talking about layers of trauma. Our whānau don't have just one trauma. They're getting traumatised from multiple angles and levels and layers. So I think, it's understanding some of the complexity of that. So what we really we're focusing the study on is what they needed and what have you, but you can't actually talk about what they need and help them on their healing journey without understanding their story. So for a lot of our whānau, it's the first time that somebody sat down and really listened to their story from beginning to end. And so, that what they wanted was resources, and this is kaimahi as well. So in my HRC application, when I have to put the reports in against the milestones, I have gone no, I haven't received, so what we envisaged at the beginning is totally different to what we ended up doing, because we needed to listen to our community, our whānau, and pivot. So they wanted tools for wellness. They didn't want tools for healing and fix-up. They wanted forms of evidence beyond social media, and they wanted mātauranga-informed tools. I'm useless when I can't see what I'm doing. What they wanted to know how to prevent their tamariki being removed from their care. For them, the processes were unclear, the misinformation was prevalent, and there was a lack of information, and they said there needs to be work at their speed, because they're dealing with a lot. what they want were things like there's gaps in the mental health and addiction services. And I think that's, we know that as a country. They say that it's not trauma-informed often. They need support persons to sit alongside of them. They talked about needing patu approaches, and they needed to know how to navigate mātauranga kaupapa Māori and mainstream services. So I think that's really critical. They also talked about the need for tāne violence programs. So, relationships were key. So we didn't just have all wahine, and you'll ask me how many tāne did we have, and I can't really tell you that because we haven't counted them up. We just call them whānau, but I will do that. But we have had tāne in those wānanga as well. They wanted programs that were conducive to kaupapa Māori approaches. They needed to be able to talk about their trauma. And I thought this was really interesting that one tāne said there needs to be a need to listen, to hear, not a listen to say approach. So they basically need the space to tell their stories. They also wanted oranga tamariki to improve their practices and models of care. It's more than, they wanted more support for whānau, not just for the kids. And in some cases, there is no wraparound services provided. And they wanted to be valued and heard by government agencies who supported their achievement of goals. And I don't think that's an unreasonable want. I think, we have now the Centre for Prevention of Sexual and Family Violence, and previously to Puna Awanui, but and they're supposed to have been working cross-agency, working together. It's very obvious in this study that they don't for our whānau. Oh gosh. So the issues were a lack of respectful interactions and shifting goalposts that compound mistrust in oranga tamariki. They identified a them versus us mentality, inequities and entitlements, services and resources. Sometimes they knew of other people who were getting things and they weren't getting what they needed. There was a lack of cultural competency in the workforce, and also talked about was an absence of humanity and empathy, and no accountability. So I think, we've got now a workforce development strategy. Whānau, they wanted whānau-led reconnecting to te ao Māori approaches, a change in generational norms. So how do they change the norms in their whānau? And I think this is really important if we think about that intergenerational violence and trauma, and you don't know what you only know what you know, basically. If you have been brought up with violence and you haven't had the opportunity to observe and learn other ways, and I know from our E2 Wahine study, one of the tāne that we included in there who'd spent 25 years inside, he said to me, Denise, he said, that's all I had in my kitty. So when things were getting tough, that's all I had. But he said, now I've developed these other things in my kitty, so I've got choice. That doesn't mean to say this is gone, but now I can choose to do other things. So I think, it's like how do we support our whānau to develop some of the skills that they need for their keti so they can make choices. tamariki need to have a voice, and they need to be able to have access to walk in holistic services. And, so an any door is the right door approach. So if you fall into one service and that's perhaps not quite the right place for you to be, where to go. And I think kaupapa Māori services are really critical in this space. So they also wanted healthy whānau. So they wanted to know things like conversations with whānau and their tamariki. They wanted to know what mana enhancing parenting looks like from a te ao Māori perspective. They wanted to know how to rebuild those bonds, how to establish routine and structure. So for some of some of us would think, this is pretty a no-brainer, but for some of our whānau, they haven't had the opportunity to have that. Unlearning toxic behaviours and learning how to express your feelings in a more constructive way, restoring relationships, expressing feelings. So and creating safe spaces that feel like home, I think, is really important. But we're talking here around enhancing the mana of our whānau. So, mana enhancing parenting, really is grounded in te ao Māori, is what we have concluded from all the wānanga, and being able to be honest without the fear of losing your tamariki or being judged. So, there was a fear and mistrust that if I ask for help, I'm likely to get my tamariki taken. And I sadly have to stand here today and say, from all the whānau and the women that I've interviewed over the years, this is a reality. And we can't deny that. And so that's a huge, big mountain to get over for our whānau. And when we should be able to say, look, this baby's screaming, I really have, run out of things to do, and I just feel like I'm going to lose it. People should be able to say that. Can you please help me? But I think, we just need to start shifting some of the way that we think and not go to the real, the go to jail sort of option without actually looking at, okay, so stepping back and saying, what support does this whānau need? So they also have charged me to be an advocate for them. They said, our voices don't get listened to, so you have to be an advocate for us. And so I feel pretty privileged to be in that position, and I will talk out for our whānau. But it's things like how to traverse the different worlds that they live in. It's like how do you address encountering judgmental and abusive people, because we hear that time and time again. When they go to services, they get treated poorly, disrespectfully, and in racist ways. And then I've heard the other side of the thing from government agency people, people who say, well, they're just mad, bad and angry women. Well, I've been through all our data again in response to that sort of response. They believe they're going to get treated poorly. So they go in with a shield up to protect themselves. They're often at crisis point when they have to ask for things. So when they get to the service, this is the last, part of the rope that they've got. So But when you look at what were the people who had good experiences of agencies, and they were pretty much in the major minority, it was kind, caring people who were willing to listen to them and recognising that telling their story might take time and doing what they said they were going to do. So I think that's really important. I think, yes, there are our tamariki that definitely need to be removed and put into safer environments. But there are some whānau that just need support in how to work with their tamariki. Also they're often acting in crisis. So it's stressful, there's a lot of assumptions made, and they often are not given the right to respond. They want non-judgmental people. They want consistency. And they also want safe places where their teenage boys can go. When you're faced with the thing of you can't go to refuge because your 10-year-old boy is not able to go, they're faced with, do you leave him on the streets or do you both become homeless? Because that's their option. It's not a good option and not a good option. So I think those things are really, they're the realities. So these all need healthy role models. And they often say they want to talk to somebody who knows my reality, who's lived my reality, and who's come out the other side. They don't necessarily want to talk to counsellors. That might come down the road, but they need somebody who understands them. So those healthy role models are really important. But I think this raises an area that's a bit problematic as well, is because, how do we get some of our whānau who have criminal records and what have you, but are out the other side, who want to train as social workers or psychologists or something, and they can't get in those programs because of their pasts. So, I think that's a big challenge, and I think that's something that we need to have more discussion around. The wraparound support, relationships, violence, and drug abuse, I think all three need wraparound support. They need education and time and accountability for people that they're working with. So they need whānau solutions. So every whānau is different. Every whānau needs a bespoke approach. One size fits all doesn't necessarily work. And also, what's my priority as a professional might not be the whānau's priority. So the starting point sometimes has to be the whānau. And it might not seem, important to us, but to them it's a fundamental thing. Prevention is key. They, all want to know how to stop what's happening in their lives, and it's difficult when you don't have the support around you. A healing-centred practice to be developed. That whole thing around mātauranga, whakapapa and karakia. We heard, I've heard lots talk about how connecting with culture, learning pūrākau, learning about values and beliefs from a te ao Māori perspective is a critical point in turning their lives, into a different direction. So we can't undervalue the role of culture in this. And, culture, te ao Māori culture is a protective factor. If you're looking at things, when you put them into practice, they are protective. And, whānau and hapu, pre-colonisation didn't tolerate violence against women and children. It was dealt with swiftly and harshly at times, a lot of the time. So solutions need to lead to positive outcomes. When I'm happy, my kids are happy. Mā te Māori, ka ora ai te Māori. So really having that Māori thing, solution. But when I say connecting with culture, I've got to preface that with the whole thing that sometimes it's not safe to connect them with kaumātua and marae. So you need to be able to listen to their story to see. For some, that might be okay, but for some, that they're not places and spaces that they are comfortable with. So they want no more struggling. They want to change the generational normal. They want to have better lifestyles. And they want a bright future for their tamariki and mokopuna. So how do we capitalise on that? We first of all have got to recognise what it is their aspirations are. Because I haven't listened to one person who says they want to continue their life as it is. They want to do things differently. They just need the support, the time and the help to do that. These should be in the slides in the booklet with the findings. So they want strong connections with whānau, reuniting with whānau if that's possible and safe, having all their whānau together. So having, like some of them, have been in state care and, the state's not always, as we know, the best parent. It's just as harmful for our tamariki. But it's how do we keep people connected? And I just want to say that, with the slides that I presented to begin with, Nick Coop and I went to Wellington and we met with Te Papuna Aoranui staff and with some Oranga Tamariki staff from the Transformation Unit, and there was a couple of other people from different organisations that were going to be there, and said, this is what's happening with our whānau. So they were pretty stunned, to say the least. But we talked about, if a child needs to be taken out of someone's care, and some of our wahine said it was the right thing to do at the time, there needs to be a plan of how they keep connected and these are the reasons why they're taken into care. This is what you have to do to have them returned. So the assumption is not they're going to lose them for life, because it seems like that for some of them. The assumption is that there are things that you can do that's going to assist the return of your children. It's not such a big deal because, having your children back, you think is like, oh yes, I get them into my care, but this is a 9 to 12 month journey while they rebond with their own parents. Strong connections, I think is really important, and feeling that sense of belonging and having healthy relationships. I mean, everybody wants to feel like they belong somewhere. Staying safe. Being able to trust others, trying to be outside of unsafe environments, All those things about being comfortable enough to do some self-healing in their futures, I think is really important as well. Having a say without judgment. Right. Tai tamariki need their voice. So as we received that message, Te Wai and Huri then undertook some wānanga with Tai tamariki. And so we'll hear their voice shortly. They also, they wanted healing. So, a whānau-centred healing. They wanted to know about adult and child behaviours, like what to expect from your children at different ages and stages. I think we take it for granted. I've got a whole story about my daughter and, her explanation for when my first moko fell off the bed on her head. And, you go through all the things like, I get the medical alert, and go through the things as does she need to go to the hospital straight away? These are the things you've got to look out. And then my third question was, so how come she fell off the bed? Because she was like 4 or 5 months old. She said, I needed to go to the toilet. And then there was this little pause, and she says, maybe she's learnt something about gravity. And I'm on that end of the phone thinking, oh my gosh. I said to her, I think I'd go that she has less about learning about gravity, but maybe next time you could put her on the floor. But it really got me thinking, actually we expect our new parents to know the developmental expectations of their children. And she clearly didn't, and yet she's the internet queen and can find anything on that internet, but she obviously didn't, she missed that. So that whole unrealistic expectations that gets some parents into hot water. It is around, a better me is a better you, and it equals a better us. So recognising that healing is really, really important. But fundamental to that is knowing your whakapapa. That was really important because it strengthened who they were and where they stood in the world. And then there's the alcohol and drug and the trauma. But there's some other things that can be done before that. They wanted to thrive, so, all the aspirations, and they wanted resources. So resources that were going to help them achieve their aspirations and create change and what have you, and being a voice and what have you. So, right, that's me. I'm early. So, I just think it's been an immense privilege to sit and listen. I think what I've learnt out of this project as a researcher and a researcher situated in a university is how important it is, if you're going to do community-based research, is to be willing to pivot and to meet the needs of our community, because they're the end users. So we will show you this afternoon the resources that we have developed. We could have done more, but, I think we prioritised what would be really important.